So a very warm welcome to everyone joining the Toileting and Fragilics Across the Lifespan webinar part one with Dr. Jennifer Epstein. So I know in Australia it's customary to begin with an acknowledgement to country. I'd like to acknowledge in Aotearoa, New Zealand, we recognise Māori as tangata whenua, the first people of Aotearoa, New Zealand, and the Treaty of Waitangi as our founding partnership document between Māori and European settlers. So my name is Andrea Lee. I work as the Executive Director for Fragilics New Zealand, and I'm also the mother of a 19-year-old son with Fragilics. So it's lovely to be partnering with Fragilics Association of Australia again for this webinar. And so toileting is often an issue for us as families. We know toilet training is an important life skill, and it often takes more time for our family members to gain the necessary skills. It's not a simple task, and we know that it can sometimes also be ongoing throughout the lifespan as different issues can come up throughout the lives of our family members. So as parents, it can be overwhelming, and I know from my own personal experience, we can often feel we are doing this alone. So it's wonderful to have this opportunity to hear from a specialist in both fragilics and toileting, and to consider ideas and strategies to support good outcomes. Well, it's my very great pleasure to welcome Dr. Jennifer Epstein. We are so fortunate to be here together with Jennifer and to benefit from her immense knowledge and experience working with individuals and families affected by Fragile X syndrome. So Dr. Epstein is a licensed clinical psychologist with more than 25 years of experience working with children and families. She completed her doctorate degree in clinical psychology from Wright State University in 1994 and has completed a 2-year postdoctorate fellowship in developmental disabilities and clinical psychology at the JFK Center for Developmental Disabilities at the University of Colorado. Dr. Epstein specializes in treatment of neurodevelopmental disorders such as Fragile X. She is a certified Early Start Denver model trainer, which emphasizes training targeting skill development within highly rewarding activities during daily routines. Dr. Epstein's clinical services are currently delivered in home or community settings or via telehealth, where she works with children and families. She has lectured nationally and internationally on the topic of Fragile X syndrome, and previously Dr. Epstein worked at the University of Colorado at Denver, where she provided diagnostic assessment for the Child Development Unit and the Fragile X Treatment and Research Center at the Colorado Children's Hospital. Dr. Epstein is in demand as a speaker and a trainer of other clinicians, so we are very grateful she has made time to be with us today and to share her knowledge about this important topic. So over to you, Jennifer.
Good morning. I am so happy to be here to talk about toileting and Fragile X syndrome. My name is Dr. Jennifer Epstein, and I will be providing a 2-part series on strategies and supports across the lifespan. This is Part A. It is strategies for use with children with Fragile X who are ages 10 and younger. Come back in 2 weeks when we'll play strategies for use with individuals with Fragile X who are 10 and older, which will be Part B. I want to begin by thanking the hosts of this webinar series, Fragile X New Zealand and the Fragile X Association of Australia. I also want to take a moment to express gratitude to all of the families that have shared their journeys with me. I learn from you every day, and I try to pass on that knowledge. Thank you so much. In today's workshop, we will be talking about a variety of topics related to toilet training. I will first be discussing Fragile X syndrome, the diagnosis of autism, and how both of those things relate to toilet training. I'll review prerequisite skills that help allow for easier toilet training experiences, and I'll also be discussing several different approaches to toilet training. I hope that today you'll begin to have the pieces in place so that you can make a good plan for beginning or continuing your journey in toilet training. I also will review some resources, and we will have time to answer some questions at the end of this presentation. So let's get started. I first want to acknowledge the work of Dr. Barry Kravitz and the Scientific Advisory Committee of the National Fragile X Foundation for the analysis of the Forward Project research on toilet training and Fragile X syndrome. The Forward Project stands for Fragile X Online Registry with Accessible Research Database, and this is a natural history project which collects data from Fragile X patients at most of the Fragile X Clinical and Research Consortium clinics. The data that we'll be reviewing today included 88 females and approximately 300 males. In this slide, we're looking at bladder training, and this is information that was gathered by families as they described different milestones their individual family members met with respect to bladder training. At the bottom of the chart, you can see that there are ages 5, 10, 15, and 20 are on the x-axis, and along the side of the chart are the percentages. What's important here is looking at the perspective of these different data points. The pink line is girls right here. These are girls who have Fragile X. And this red line, these are girls who have Fragile X and also autism. And this green line is boys who have Fragile X. And this blue line is boys who have Fragile X and autism. And you can see that at about age 5, many of the females have attained bladder training. They're using the bathroom readily to take care of their toileting needs for urine. You can see that some of the boys are also using the bathroom, but a lot are not. And if you look at the boys over time, you see that by age 10, that people are still continuing to learn how to use the toilet. And at 15, they're continuing to make progress, and it continues onward. And what's important here is noticing that girls are going to train earlier, and the boys are going to have a history of learning how to use the bathroom that lasts a longer period of time. By age 15, about 70% of the boys with Fragile X have achieved bladder training. Now, when we look at bowel control, we see a similar pattern. We see that girls train earlier. With girls who have both Fragile X and autism, they typically attain bowel control by about age 6, so a little bit later than the age 5 that we saw for urine control. But we continue to see that the males take a longer time to train, but more importantly, that they are still making gains in this important life skill. And so between the ages of 10 and the ages of 15, we continue to see growth and progress. This is really important because this allows us to see that we need to have an individualized approach. Some of the factors here that stand out are that if an individual has Fragile X and autism, that the path towards toilet training may be a little trickier. It's also important to note that the research demonstrated that children who had more severe language delays, children who had more significant cognitive delays, and children who had greater irritability or hyperactivity also had greater difficulty in achieving toilet training. Now, I say all of that because it's important to understand that the data shows that the beginning part of toilet training takes longer for most people who have Fragile X. So age 5 is not the normal time that typically developing children might attain toilet training skills. That might happen a little bit earlier. But overall, children with Fragile X are achieving toilet training a little bit later. It's also important to note that this presence of autism and intellectual disabilities also can lead to this later onset of toilet training skills. And so we need to have realistic goals And then we also need to individualize our approach to toilet training. We need to figure out what is the phenotype for the individual with Fragile X. What is their behavioral phenotype? What things are going to be easier for them? What things are going to maybe complicate toilet training, and make accommodations to specifically address those areas of concern. We also need to recognize that we cannot assume that all individuals will benefit from the same strategies. So today we're going to explore some of these different details so that we can help you on the path to creating a good plan to support toilet training for the individual with Fragile X in your life. So let's talk first about prerequisite skills. There are lots of skills that allow for toilet training to happen a little bit more smoothly, and these are called readiness skills or prerequisite skills. For example, can the individual tell that they're wet? Does being wet bother them? Can they communicate if they are wet, or if they know they need to use the bathroom? Can they communicate that to someone? Do they have the skills to either verbally or gesturally communicate that they need to go? Can they recognize that their bladder is full? Are they able to attend to those physiological sensations? And are they able to follow one-step directions if someone asks them to walk to the bathroom, or to stand up, or to sit down, or to pull down their pants? Do they understand those instructions, and can they follow those instructions? So those are some beginning cognition and communication prerequisite skills. From a physiological standpoint, we look for pre-readiness skills, including periods of dryness. Typically about 90 minutes to 2 hours is a wonderful window of time, but certainly at least 60 minutes between wet nappies. Now, this is important because if the interval between wet nappies is shorter than this, and you try and do toilet training, your child is going to be on the toilet all of the time, and everybody is going to be frustrated. So we don't want that. We're looking for a fairly regular schedule for voiding and for bowel movements, and we'll talk about how to track that using a log in a few minutes. We also want to look at motor skills. Motor skills, including motor tone, allow someone to get their body into the bathroom, to be able to sit on the toilet independently. Those are important skills. Also, the skill motorically to be able to pull pants up and down, and the ability to sit in one spot for several minutes at a time. These are all things that really allow for toilet training to occur, because you have to sit and relax long enough before you can go and eliminate on a toilet. Now, it doesn't mean that if your child doesn't have all of these prerequisite skills that they cannot be toilet trained. But paying attention to these prerequisite skills really does allow us to begin to figure out how quickly are we going to be able to progress, and what types of additional supports might be helpful. Before beginning formal toilet training, it's important to think about addressing physical issues that might get in the way of this process for your child. It's important, if you're thinking that there could be a medical concern or a physical issue, to talk about it with your general practitioner or your pediatrician. For example, individuals with Fragile X sometimes have stool consistency issues. They can either have loose stool, or they can struggle with constipation. And it may be important to add fiber supplements or to change something about the diet in order to make stool consistency be more appropriate in line with toilet training. Medications can have side effects which can lead to loose stool or constipation as well, and the GP would be someone who could offer advice about those things. I also want to mention that prolonged constipation can be really tricky, because prolonged constipation can create anxiety around elimination. It can cause discomfort. It can also stretch out parts of the colon in such a way that it can be harder for children to pay attention to physiological symptoms of a full bladder because they're so constipated. So we do want to really pay close attention to what's going on with the body and get these things checked out with a GP before you start toilet training. It wouldn't be a lecture about Fragile X if I didn't talk about sensory issues. Now, with respect to toileting, the bathroom can be a place where there are lots of different sensory experiences that come up. Many children have difficulty with gravitational insecurity. In other words, they have difficulty knowing where their body is in space. And so when we ask them to sit on a toilet, it can be challenging for them. It can feel uncomfortable. It can feel like their bodies aren't well supported. So we want to make sure that we address this by placing the potty on the floor or by using steps that are solid to add a feeling of security. The squatty potty, which is available on Amazon, is a plastic step stool that kind of wraps around the base of the toilet that was designed to help aid pooping, but it actually can be quite good for helping individuals feel grounded and to get their pelvic floor in the right position for avoiding urine as well. It's important to think about eliminating exotic smells that might be in the bathroom. And by this, I mean some people have a tendency to put air fresheners or potpourris or burn candles in the bathroom. And while that might be nice for you, it may not be nice for a child who is struggling with really heightened olfactory awareness. And so the scents that you've put into the bathroom to make it smell better may be really overwhelming for an individual with Fragile X. Lastly, we need to pay attention to auditory sensitivities. So for some children, the flushing of the toilet can be really alerting and can even be concerning and for some terrifying. So it's important to know that about your child. And if you think that that's going to be an issue, you might wait to flush the toilet till after they've been in the bathroom. Or certainly you might delay it until after they have more experience practicing toileting. Now, in terms of motor issues, it's important to dress your child for success. And by this, I mean making sure that you have clothes that are easy on and easy off. Loose elastic bands, oversized sweats, drawstrings. It's almost summer where you are, so shorts that are easy to come on and off, ones that don't have a lot of snaps or buttons would be best for beginning toilet training. I also want to talk about exploring information about toileting. This is a broader slide in that I'm really talking here about all of the different ways you can begin to reference toileting in your day-to-day life. You can watch videos, or you can read books with cartoon characters that your child might like. You can narrate what you're seeing. If you're taking your dog on a walk and the dog is using the bathroom, you might talk about it with your child. You want to make sure you're using simple language. He's going potty. He has to poop, things like that, so that your child understands what you're referencing. If you're comfortable, you can allow your child to watch an older brother or a younger sister who's learning how to use the bathroom or practicing toileting as well, to continue talking about toileting approaches. It's important also to have opportunities to practice toilet training. If you have a child who's interested in pretend play, you can practice toileting with a doll where the doll is sitting on the potty or a stuffed animal is sitting on the potty. In this slide, this is Potty Elmo, and he is designed to actually drink from a sippy cup, and he makes noises, and he says he needs to go to the bathroom, and then you can try and get him to the toilet on time. And sometimes he makes it and sometimes he doesn't. And it also normalizes that accidents happen. So again, exploring information about toileting allows you to really begin to teach the sequence and the steps to toileting in a lot of different ways. Books can be highly motivating. And on this slide, I've included some of my preferred potty books that I've had lots of success with. the book Paw Patrol's Potty Patrol has the preferred Paw Patrol characters in it. Of course, Sesame Street is oftentimes a hit, and this is an Elmo potty book, and it has buttons that play music and sounds, and that's fun. The Chugga Chugga Poo Poo Potty Train teaches the steps to pooping on the potty, and then Everyone Poops and Poopsosaurus are also really good books for introducing concepts related to poop. So these are just some of many books that are out there. And if you end up having some preferred ones that work really well for you, email me and let me know that that has gone well. I'd love to hear about new books. You'll remember that I referenced that communication and delays in communication can make toilet training more challenging. And so we want to make sure that when we're thinking about accommodations for getting ready for the toilet training process, that we've really thought about how we can use visuals or simple communication devices to help communicate what needs to happen. As I've mentioned, we want to use simple, consistent words to refer to body parts or to the actions that are involved in toilet training, such as go potty or wipe bottom. If your child is nonverbal, you can use their familiar communication system. They might be on PECs, or they might have an assistive technology device. They might have picture sequences that they're using. In this slide, I have a simple picture of just a toilet that you can pair with your trips to the bathroom so that you're holding it and pointing to it and going to the bathroom with the picture. You can use the universal sign for bathroom and model the use of the sign each time you take your child. The idea is that you're pairing additional supports for communication that are visually based so that your child has a lot of different modalities to make the connection between the suggestion that we're going to go to the bathroom and then getting to the bathroom, so that one day they have a way of letting you know when they need to go. At the same time, we also want to think about concepts like wet and dry. These are really important concepts in the process of toileting. So when you're doing your nappy checks, you want to label what you find by saying, oh, dry pants, good job. Or, oops, it's wet, let's change that nappy. Remember to be positive here, but it's really important to begin to work on the concepts of wet and dry as you're going through these beginning steps. Visuals can be really helpful for teaching a toileting sequence. In these slides, I have just a few highlighted steps. I've individualized this toileting sequence for the person that I developed it for. So in the first step, this girl is walking to the bathroom, and then she's sitting on the toilet, and then she's wiping with toilet paper and flushing and washing her hands. You'll notice I don't, in this toileting sequence, have pulling down her pants or pulling her pants back up, because those were not steps that she was forgetting. She was struggling with the steps that I have depicted here, and so those were the reminders. But you're going to individualize your steps for your child to support what they need. Some children need many pictures, and some children just need a few. Now, we've discussed different ways that we can make accommodations for getting ready for thinking about toilet training or continuing your journey on toilet training. What I'm going to talk about now are some different toilet training approaches. Now, some of you may have already successfully toilet trained one or two or maybe many children. And some of you may have done this without having this lecture, and you've done just fine. So I want to give you permission, if you have used a general approach and had a few accommodations that you thought of on your own and it worked for you, that's great. Keep doing it. That would be this first box here, a general approach with some accommodations. If you have a couple of ideas from this workshop so far and you think that that's enough, I would certainly suggest you're fine to try that. But in general, I think most families are going to find that either toilet training on a schedule or practicing trip training, which is a toileting approach that creates a predictable routine with low pressure. Those two approaches are typically the ones that are most helpful for families who are toilet training. Intensive toilet training, I don't spend a lot of time talking about. In fact, this is about the only time I'm going to mention it. And it's not that it couldn't work. It's that in my experience, it hasn't worked for most families. And for many families, it can become very frustrating. And the last thing that I want to do is make a suggestion that could make things trickier rather than easier. So I'm not going to spend time talking about that approach, although I do acknowledge that for some families, it can be successful. The first thing that I'm going to ask you to do is I'm going to ask you to keep a log for 1 to 2 weeks before you even start a toilet training process. If you've been working on toilet training and you haven't kept a log, I would suggest that you start keeping a log now. The log is going to help you keep information, and you're going to check your child each hour. The log is going to tell you how often your child voids and roughly the time between when they drink or eat food and when they need to void. This log is going to help you be able to predict when the toilet trip is going to be most successful. And this is why it's important to keep the log. So in this example, you'll see that at noon, the child had food and a drink and their pants were dry. They didn't have wet pants. They didn't have a BM in their pants. They also didn't use the toilet. At 12:30, a half hour later, they were wet in their pants. And then you can see that at 1:30, they had another drink and they were dry. And then at 2:00, they were wet again in their pants. So just in this tiny example, you can see that the window between when they eat or drink and then voiding is about 30 minutes, but that they have about a 90-minute window between their wet pants. So that lets us know, wow, this is someone who actually is holding their urine for about 90 minutes at a time. And there's a pretty clear pattern, at least in this beginning data, between when they've had something to eat or drink and when they've needed to go to the bathroom. That's great when it works out that way. Sometimes when you're taking data, there's a lot of scatter, and that's why I suggest you keep a toileting log for 1 to 2 weeks, because you want to start to see if there's a pattern. So this is the approach, toilet training on a schedule, where you're going to use the log data to help guide successful times so that your child learns to go to the bathroom when they're taken to the toilet. We're not waiting for your child to initiate or to tell you they need to go. We're just taking them at regular intervals, and we're trying to time when you take them with when they're likely to need to go. The log is going to let you know important key factors like how often is my child wet? Diapers and nappies are so absorbent these days that sometimes parents don't really know how often their child is going because the child isn't uncomfortable. And so we may not change the nappy until it's really full, but it's possible that the child has gone in the nappy more than once. That happens sometimes. We have busy lives. By keeping the log, you're also going to begin to know how long they can hold their urine. How often do they go at different times of the day? Some children go more often in the morning. Some children go more often after school. Some children have a BM at a very consistent time of day, or after dinner or after breakfast. Some children don't have a consistent time of day, or they may move their bowels multiple times in a day. It's really important to keep the log and also to change your child each time they're wet and use words again, oh, you're wet, let's change. Just matter of fact like that. And that, again, is pairing the concepts wet and dry with the diaper changes, but it also is helping you to record this very important information. Once you have your log, you're going to begin to use your log information so that you can begin to shape your child's toileting routine. You're going to try the scheduled training if your child doesn't have all of the prerequisite skills. Or even if they do have all of the prerequisite skills, it still may be helpful to start with scheduled training. You're going to take your child once every 60 minutes, and you're going to have your child sit on the toilet for 2 to 5 minutes. Now, some children cannot sit for 2 minutes at the beginning of this routine, and that's okay. You can just have them sit for 30 seconds. You can sing a song like the happy birthday song. You can use a visual timer on your phone. And when we get to resources, I've included some information about apps that can be helpful. But you're basically going to have your child sit on the toilet. And then if he or she voids, you're going to celebrate and give them reinforcement, lots of social praise. But if they don't, that's okay. You're going to finish the rest of the routine, pulling up their pants, washing their hands, and then you're going to leave the bathroom for about a half an hour. You're going to go back to whatever they were doing before, and then you'll bring them back to the bathroom in about a half an hour to see if then they're ready to go to the bathroom. Now, it's possible that in that 30 minutes, they wet their nappy, and that's okay. Then you'll just put on a dry one, and then you'll reset the timer for an hour. It's also possible that when you take them in 30 minutes, that they're still dry and they aren't able to void on the toilet. And then you're going to, again, have them practice, finish the routine, and then you'll go back to what you were doing. Eventually, one of two things is going to happen. Either they're going to wet in their pants, or they're going to wet on the toilet. And either way, you're going to start the timer then again to 60 minutes and then bring them back 60 minutes later. I'm glad I wrote it all out on the slide, and I'm happy to create a handout because that's a lot of information, but it's really not that tricky. You're going to use the toilet log to guide and individualize your timeframes. So for example, if your child, you find in the data, is pretty dry for 2 hours at a time, then you don't need to take your child every hour. Some children may be able to hold it for 2.5 hours, and that would be the time frame you would be bringing your child to and from the bathroom. But by keeping the log, it's going to help you learn more about that window between when they eat and drink and when they need to use the bathroom. For children who are camels, who are not going very often, and you're at the very beginning of a toileting routine, you might want to try and increase how much fluid they're drinking so that they need to go a little bit more often to learn the routine. Once your child is having accidents less than once a day, or maybe once a day, you can begin to increase the amount of time between scheduled visits by 15 to 30 minutes. And as I've mentioned, you can also increase the time if your log data shows you that you don't need to be going more often than the window between when they're having wet nappies or using the toilet. In this interval, some children just start to go independently when the schedule is lengthened. But I want to make this clear. Some children do not. And for some children, it is okay. I have known many individuals in my lifetime who are adults who still use an interval schedule for toileting. And as long as they have a reminder from a carer or from a timer on their phone that reminds them that it's time to go, they stay dry. And that's wonderful. So it is fine. My goal is to just have people be able to use the toilet when they need to use one, and not necessarily to teach independence in taking themselves there in terms of initiating the trip to the bathroom. And of course, some individuals will be able to do that, and that's a wonderful thing to celebrate also. Now, I mentioned that there are two different approaches, and one approach was what we just talked about, going on an interval. This second type of approach is trip training, where we're basically teaching the bathroom routine. Our initial goal here is to teach the sequence, not to teach the child to actually void on the toilet. That's secondary. If it happens, that's wonderful. But our goal here is to simply teach the sequence of pulling down the pants, sitting on the toilet for 1 to 5 minutes, wiping, pulling the pants back up, flushing, and washing hands. Now, the reason why we want to think about trip training is think about those beginning slides I showed with the data. If we know that some people are not going to successfully learn how to void on a toilet until they're 10 years old, it doesn't mean we wait until they're 10 years old to practice. Practice over time allows a child to begin to learn the steps. And by practicing in a low pressure way, maybe once a day, maybe twice a day, you're giving the child an opportunity to learn the skills without a lot of stress and without a lot of anxiety. And when they have more of the prerequisite skills and you feel more certain that they're ready to go, then you can begin to change the approach you're using. But our initial goal for trip training is to just rehearse the strategies and skills involved. Now, which approach should I try? Well, if you are seeing predictable patterns of voiding, you might try schedule training. And if the pattern that you're seeing in your data log is inconsistent, or your child has frequent tantrums, or has prolonged stimming and it's hard for them to focus on what they're doing in the bathroom, or they're very hyperactive, or they're very irritable, or maybe they were potty trained, but then they had a regression, or there was a traumatic event in their life, or they're just not motivated right now to go, then trip training may be a better solution at this time. And with trip training, you're really trying to choose times where you can fit a trip in that becomes a consistent pattern. For example, before bath time is oftentimes a good time to practice sitting on the toilet because your child is already going to be naked. And also maybe you're filling the bathtub and they're hearing the water. And for some children, hearing water can allow them to release their urine. So for some children, it's a really good time to practice a trip to the potty right before bath, or maybe first thing in the morning, or right after nap if their nappy is still dry. For most individuals with Fragile X, as I've mentioned, the intensive toilet training approaches are not recommended. So really what we're looking at here is, do you want to try schedule training or do you want to try trip training? I want to normalize for a minute that accidents happen and that this is how children learn. It's also how adults learn. This is how people learn. So we want to be calm and be prepared about accidents. And by being prepared, we want to have what we need to clean up situations easily. We want to have a place to put wet clothes so that you're not doing laundry all day long. Make sure you're not showing strong emotions. Please don't yell. Please don't have long discussions. I promise this won't make anyone feel better. And try and keep it positive. And if you can, try and find a way to find some humor in it. There are some questions that come up commonly. One is the use of cloth underwear. Is it necessary? It is not necessary to use cloth underwear. For some individuals, it can be quite helpful, and we'll talk about that a little bit. And for some, it doesn't really make a difference. Some children are not uncomfortable when they're in a wet or soiled nappy. They're just not. They don't notice it. As I mentioned, the technology of disposable diapers is such that when you're using disposable nappies, they soak up everything, and your individual may not feel wet. They may not register it, or they may not be bothered by wet clothes in general. For other individuals, it can be uncomfortable, and that can be a pre-readiness signal. You'll see kids who are taking off their wet pull-up and leaving it places. And if you have a child like that, it definitely is an indicator that it's a good time to continue down the path of toilet training. You can also, one reason why I don't like to use cloth underwear at the beginning is because you might be having a lot of messes, and it can be discouraging, and people, both adults and children, can get really frustrated. But you can also use cloth underwear and put it inside a nappy or inside a pull-up so that the child is still getting the feedback of having wetness against their skin, but instead of having it be a big mess all over the place, it's contained. You can also put just a wet cloth, like a small infant washcloth, in a nappy to help your child register that it's wet. And then there's less mess to clean up later, less things to launder. How about bells, buzzers, whistles? Do they help? They can. They can be helpful for some individuals, but they can also be challenging. The use of bells, buzzers, whistles can have a lot of auditory information, and it can be alerting, or it can even be create an avoidant pattern where a child becomes more anxious because they've got this thing that's buzzing and they don't know how to control it yet. But again, for some individuals, it can be helpful. I don't suggest using bells in the nighttime because I think there's already enough sleep issues with Fragile X. We don't want to create additional sleep issues. How long will this process take? That's another question that comes up. I wish I had a crystal ball and could tell you. It can take not very long, or it can take a really long time. And overall, I would say it's a marathon and not a 5K sprint. So for this reason, I think you have to really listen to yourself and pay close attention to your child. If you see that you are becoming frustrated as a parent or as a carer, or if you see that your child is having frequent tantrums when you're taking them to the bathroom, then I think it can be really worthwhile to take a break. Nobody has to do this from beginning to end all at once. Sometimes breaks are important, and you regroup, and then you come back at it 3 months later or 6 months later or a year later, and you're in a different place emotionally, and your child is in a different place developmentally, and maybe they have a few more pre-readiness skills. This is why I think the trip training can be so helpful. What if I still don't think my child is ready? Well, no one says you have to do this today. Again, listen to yourself. Listen to people around you. Talk with someone that you think you can get some encouragement from. Talk about the pros and cons of starting down this path right now, and then make a plan. And it really is okay to not tackle this today. Some people think it's great to do over summer vacation. Other people think that's not a good time to do it. You know, every family is different, but I do think that you're looking at months and sometimes years and not weeks or days. And so plan accordingly. It's really important to individualize your approach to toilet training, to keep it interesting. You want to use your child's interests to motivate them to stay seated. There are lots of ways to do that. I've mentioned a timer, and at the bottom of this slide, I talk about the countdown timer app, which I have on my phone, and you can individualize it. Mine is a duck, and when the timer goes off, not only can the child see the time go so that they can see when their time is up, but when their timer goes off, a special thing happens like confetti, or there's a lot of different screens you can choose so that it's pretty exciting. So it's motivating to sit and wait. And then when the timer goes off, they can get up and be done with it. You can individualize the time. I also recommend keeping high interest toys or books on a high shelf in the bathroom or in a basket under the sink, someplace where you can pull them out when your child comes into the bathroom so they have something to do, but also something that you can take away as they stand up to pull up their pants so that you can put it back out of reach for when they're so that it's safeguarded, so that the next time they come in the bathroom, they're still excited to get access to those toys. And I usually have a choice of toys and books and things that they get to hold when they're cooperating with toilet training. Once you're having consistent success, you can give your child access to small rewards, stickers, small pieces of candy, baseball cards. Again, individualize it. This encourages the process. But it is really important to hold off introducing rewards, especially things like candy, until after they're already having regular success. There's nothing more frustrating than wanting a piece of candy and not yet really having the skills that allow you to relax your body to do what needs to happen. And so we don't want to set them up for failure by offering something that they don't have the skills yet to access. So keep that in mind. I also want to mention, be creative. I had one family that their child was really motivated by, they put drawings on toilet paper squares, and they would put the toilet paper in the bottom of the potty, the one that sits on the floor. And their child really liked to, they were ghosts and goblins. It was near Halloween time here. And their child liked to make the monster go away by peeing on it. And that was very motivating. And this little girl had a funny sense of humor, and the family knew it. And that was an approach that really worked. So again, be creative in your approaches to keeping it interesting. Now, this wouldn't be a lecture on toileting if I didn't talk about a couple other ways to individualize treatment of the toilet training process. And this is a picture that was shared to me with a family, by a family, and they were really excited because they thought their son loved Thomas the Tank. And so they thought if they drilled a hole through this train and added a straw, they could have the train go around the top of the toilet seat, and it could be peeing into the potty, and then their child would want to go just like Thomas. And some creative ideas backfire, and their child was really upset by the fact that Thomas looked different and had been altered. And in the end, that was not motivating to him at all. But this family continued to be creative. And this next picture shows what eventually worked for their son. He was super motivated to practice playing the drums in the bathroom. You can see that we have the step stools for his feet here, and you can see that the toilet paper roll has been removed because they didn't want to have an additional distraction. So he can sit comfortably on this tall toilet, play his drums, and this is what allowed him to be successful in toileting. So again, be creative, think outside of the box, know your child well. I can't wait to hear all of the things you try, and more importantly, the things that you find that lead to the path of success. Here we are at our resources slide, and I want to talk about a couple of key resources here. The first is a video that's available on YouTube. It's Dr. Susan Hepburn in her toilet training for children with special needs. Dr. Hepburn is at the JFK Center for Autism in Denver, Colorado. And this is a really wonderful workshop that she provides for parents that provides an overview of strategies for toilet training. It's about an hour and a half, and it's available on YouTube. There are some additional resources that are available from the foundation, the National Fragile X Foundation. There is Toileting Issues in Fragile X Syndrome that provides an overview of the research that I reviewed at the beginning of today's workshop. There are also some other resources that are available. Please Don't Poo-Poo This Article by Jane Dixon Weber is a wonderful step-by-step of how to systematically teach your child how to poop in the potty if they're right now at a place where they only want to poop in a pull-up. This is a really common situation that develops, especially for individuals who are in pull-ups or nappies over a prolonged period of time. And so it's really a beautiful article. It's not terribly long, but I have seen this approach be very successful for people. Another resource, Dr. Braden and I have a toilet training the older child that's available on the foundation website. And then there's also the journal article by Dr. Barry Kravitz et al. That reviews toilet training in Fragile X syndrome. That's a longer version, but it covers many of the things that I've covered in today's workshop, but it's all spelled out if you want some additional details.